Hi, my name is Dr. Constance West, and I will be conducting a presentation on how students have been or being affected by the coronavirus pandemic, so coronavirus 19 pandemic. That is a very complicated and involved subject, but I will try my best to keep this brief with the understanding is that you will just get enough information to sort of wet your whistle. Hopefully it will serve as an appetizer for you, and then you can go about obtaining additional information as needed. So I'm going to start off by telling you a little bit about me as an introduction. I am a health clinical psychologist, licensed in the state of Georgia. I've been licensed here since 2003. I have several specialty areas. They include disaster mental health, health clinical psychology, focusing on people living with infectious diseases. My primary experience in that area has been in working with people living with HIV or AIDS. But I've also worked in a number of different settings addressing other infectious diseases. Let's see, I've also worked in the area of juvenile forensics. So I worked for 8.5 years as the manager of a mental health clinic that was situated in a juvenile court here in Atlanta. So I'm based in Atlanta, Georgia. I've really focused throughout my career on the promotion of health equity. And that is something that's near and dear to my heart, which makes me especially excited about conducting this presentation for all of you today. Just to give you an idea of where I've worked before, I've worked for the Center for Disease Control and Prevention, meaning the CDC. I've worked for the Atlanta VA Hospital and its infectious disease clinic, as well as its geriatric clinic and spinal cord injury clinic. As I said before, I worked in the juvenile court setting here in the Fulton County Juvenile Court in Atlanta for 8.5 years. And currently I am a psychologist in private practice. So without further ado, I'm going to move on to the presentation. I will be sharing my screen. Okay, so I've already talked to you about the title for my presentation, my objectives. I'm going to provide you with a quick overview of key COVID-19 information and statistics from the global, national, and state levels. I'm also going to identify a number of different ways in which individuals have been impacted negatively by COVID-19, financially, emotionally, and behaviorally, with an emphasis on students. And last, I will provide some useful strategies and tips for promoting emotional well-being and health equity among students. Okay, so what do we know? And I'm sure this is a review for everyone, but as of today, which is June 11, 2020, per Worldometer, the total number of cases for COVID-19 globally is almost just short of 7.5 million cases across our planet. In terms of currently infected patients, there are a little over 3 million. The good news is that 98% of those cases involve very mild conditions, with only 2% being serious or critical conditions. The number of people who have recovered, which is also very promising already, is almost 4 million, so 3.8 million. And the number of deaths thus far globally is a little under 420,000. Right now, there's no cure or vaccine, but there's very promising research underway, which is also a good news item, which we so sorely need as we deal with this pandemic. So what are some of the symptoms? So people typically, at least early on, talked about 3 symptoms to be concerned about. One was fever, and almost everyone who has COVID-19 thus far, based upon our research, looking at about 98% of those people, start off with a fever, followed by a dry cough, and then shortness of breath. So those are the 3. Fever, dry cough, and shortness of breath are the 3 hallmark symptoms of COVID-19. However, there are a lot of others, which makes it really complicated in terms of diagnosis, even for us. So there are things like fatigue, which any of us can experience, especially if you're not getting good sleep, chills, repeated shaking with chills, muscle pain, which can Also happens to almost anyone. Headaches, which could be related to any number of conditions, sore throat, loss of taste or smell, and then a number of other conditions. There's also some indication that there's some blood clotting that people are experiencing, as well as some a condition or a set of symptoms associated with children, which I won't have time to go into today. Just wanted to have a quick note: having a runny nose, sneezing, a stuffy nose, and things of that nature are pretty rare symptoms of COVID-19. So for those of you who have seasonal allergies, you don't have to worry so much. Okay, so those are not typical symptoms. Okay, so we talked about what's going on across the planet or globally. So as of today, the CDC here in Atlanta has indicated that the U.S. has just shy of 2 million confirmed cases of COVID-19, with about a little over 17,000 new cases as of yesterday. And that represents about 1/4 of the world cases. That's actually a decrease. I think the last time that I gave this presentation about a month ago, the number of cases in the United States represented 1/3 of the world's cases. In terms of deaths, we've had 112,133 deaths thus far, as documented, with 950 of those being new cases as of the last day or so. That also represents about 1/4 of the world's deaths. And then in terms of testing, we're up over 22 million people, or 22 million tests have been conducted. Sometimes it may have been people who have had repeat testing, so it's not the number of people, but the number of COVID-19 tests that have been conducted is a little over 22 million, with about 11% of those tests resulting in positive results, meaning that those people tested positive for COVID-19. Keeping in mind that we represent about 1/4 of the world's cases and deaths, the U.S. only represents 4% of the world's population. So we're seriously overrepresented in COVID-19 cases and deaths. This is some information about what's going on the state level, with the highest rates being the most saturated color, so the darker the blue. I don't think anyone is surprised based upon the news that's been coming out about New York and Florida and Georgia, Texas, California, etc. But there's also new indications that there have been increases in those states that don't necessarily have the highest concentrations of populations, and that's the latest thing, especially with the reopening. Okay, good news item also is that we have flattened the curve. Okay, so when we talk about flattening the curve, rather than having, an exponential increase in the number of new cases reported, which is what we were doing sometime in March and early April, we've sort of flattened that curve, and it seems to be somewhat of a decrease overall. However, not significant, and certainly not enough to justify reopening many areas of the country. All right, so who are the high-risk groups? And this is going to be important as we think about our student population. So the elderly, although some elderly people are enrolled in school, typically not. People with any serious underlying medical conditions, everything from hypertension, diabetes, to chronic lung disease, kidney or liver failure, even obesity. Those people who are living in cramped or crowded spaces. So that would be definitely, I know we've seen a lot about nursing home cases in which many of the residents have tested positive for COVID-19 and have subsequently been hospitalized, and many unfortunately passed away. There's also high levels among enlisted individuals who are on ships, so Navy ships or prisons, jails, that type of thing. Of course, the homeless is always a very vulnerable population. And with respect to race and ethnicity, looking at African Americans, American Indians, Alaska Natives, and Hispanics representing high-risk groups as well. If we look at the age-adjusted COVID-associated hospitalization rates by race and ethnicity, what we see are elevations in terms of non-Hispanic American Indian and Alaska Natives, non-Hispanic Blacks and Hispanics having rates over 100. So per 100,000 people in the population within that group. We're talking about over 100 of them are to be hospitalized, compared to under 40 for non-Hispanic Asian or Pacific Islanders and non-Hispanic whites. So an overrepresentation of American Indian, Alaskan Natives, African Americans, and Hispanics in terms of those individuals who are hospitalized, even when adjusted for age differences across those populations. Now, when we talk about hospitalizations, we're also talking about COVID-related deaths. And as this graph indicates, for the green is for African Americans or Black individuals, with the rate being over 60 per 100,000 people, and that's through June 9th, so very recent data. That compares to being somewhere between 25 to 35 for other racial and ethnic groups per 100,000. So looking at it again, with African Americans being overrepresented both in terms of hospitalizations for COVID and deaths associated with COVID. So why would this be? This would definitely be an all-day workshop, at least I think it would be, looking at the social determinants of health. And there are a lot of different models and frameworks that I could have identified, but I went with the framework set identified by the World Health Organization, so WHO. And it goes into a lot of different structural determinants and intermediary determinants of SDH, or social determinants of health. So, and all of these things would have an impact upon equity, health, and well-being amongst a particular population or for a particular individual. So we have things that are totally independent of the individual. So we're talking about things like political issues and socioeconomic issues. So if we look at more political issues and societal factors, looking at governance, microeconomic policies, social policies, public policies, and then culture and societal values. And then we start to look at things like socioeconomic position, social class, gender, ethnicity, and including racism. So look at SES, or socioeconomic status, which we usually talk about education, occupation, and income. And that's going to be important because depending on the type of work that someone does or the amount of income that someone has is going to make a big difference in terms of their ability to access resources. So even being able to work from home is affected by one's education and one's occupation as well. And then there are a number of other factors which have to do with behavioral things such as exercising, taking your medications, accessing healthcare, et cetera, which would be under behaviors or biological factors, so predispositions and things of that nature. All of those things have an impact on equity related to health and well-being. Okay, so how have individuals in general been affected by COVID-19? Well, there has been a recent study, and I'm expecting that, given this study was done back in early April of this year, that I'm expecting that these numbers would be even higher if it were repeated at this time. So this is a Kaiser study that indicated that about 72% of Americans, so almost 3 out of 4, had indicated that their life had been disrupted a lot or some by the coronavirus outbreak, with 74% saying that the worst is yet to come. Over half worried that they or a family member would get sick with COVID-19, and over half also indicated that they were worried that they would not be able to afford testing or treatment. A scary thought. Many had already lost their jobs. So we're looking at almost 40% had already lost their jobs or had decreased hours. Many were worried about the healthcare system being overwhelmed, everything from whether or not there would be enough PPE to whether hospitals would have appropriate equipment or be overrun. Nearly half felt that worry and stress related to the coronavirus had negatively affected their mental health, and about 1 in 5 saying that they had had a major impact. And I would guess that number has gone up. Not only that, if you fold in on top of that all of the really stressful and traumatic experiences associated with not only, well, the death of George Floyd, but also all the other similar events, and then the protests and marches and all the other activities and the political situations that have been going on. If we add all of that together, this is just related to COVID. If you add everything else on top of that, I would guess that the numbers would be even higher, significantly higher. Okay, so that's the impact on just individuals in general. So what do we know about what's been going on with students? And again, I'm gonna just quickly run through this, but I'm sure many of you already know a lot of this, or if you don't, that there are a lot of good resources out there, and I can provide that to you, perhaps in a separate document. Okay, so what do we know? So a recent study that was conducted by Best Colleges indicated, provided some data that I'm gonna summarize here. So the first thing is, one of the questions that they asked was, or one of the items on this survey was, I am a student in my life. I'm experiencing increased stress due to the coronavirus outbreak. And what they found was over half said they strongly agree with that statement. And then another 31% said that they agree, but just somewhat. So we're talking about almost 81% saying they either somewhat or strongly agreed with the statement that they were experiencing increased stress due to the coronavirus outbreak. On the bottom of the slide, there's information about how people responded, students responded to the item that read, the coronavirus outbreak will impact my ability to enroll or stay in school. And what we have here is a breakdown. So we have overall about 44%, a little over 44% of students overall, independent of race or ethnicity, indicated that that they agreed that the coronavirus outbreak was expected to adversely affect their ability to enroll in school or stay enrolled in school. If we look at that breakdown by race and ethnicity, what we find is that for Black, Hispanic, and other culturally diverse students, those numbers are much higher, those percentages are much higher. And so we're looking at somewhere around that 60% or so of students of color indicating that they felt that the coronavirus was going to adversely affect their ability to either enroll or stay enrolled in school. And so it's going to be important to target those students, culturally diverse students, so that we can prevent them from dropping out of school for a variety of reasons. And we can talk about that, or I'll talk about that a little bit more later. So I've talked about how students have felt, or general people, and then students in particular. And now I'm going to talk just very briefly about online instructors. So with the switch from in-person classes to online classes or teaching, instructors have had to play catch up. Of course, some instructors were very savvy about that, very skilled at conducting virtual or online classes, others maybe not so much, and others not at all. And this was also part of the Best Colleges study results, indicated that 33% of online instructors said that they had difficulty developing a learning community at a distance, or a sense of community among students at a distance. And about 14% said they had a hard time adapting their teaching style from on campus to online classrooms, and 10% said they had challenges associated with maintaining or updating their online course materials. I can say as a clinician, I absolutely love to see clients in person. And I really resisted switching over to virtual or online sessions or telehealth sessions. Although I conducted them before at the VA and found them to be very helpful, I just didn't think that it was the same, and that I really resisted transitioning over. And even when I knew that it was clear that I was going to need to do that, with the coronavirus pandemic, I really resisted it. I was hoping that, there would be something I could work out, or I really had to get my mind wrapped around that idea of switching from being live and having this virtual environment. And I actually find that it's a lot better than I thought. Not the same as being in person, but there is some closeness, there's intimacy still, and definitely for existing clients, new clients is more of a challenge, I feel, for me. So I can understand why some instructors will have difficulty switching over, especially if they've really honed their teaching style based upon in-person interaction, to move on to what can seem sort of dry in terms of online classes. So clearly instructors are going to need some support, additional support. Or many of them will be forced to retire or switch to another situation in terms of employment. Okay, so what happens when people are affected by COVID in terms of their emotional well-being? Well, anxiety is the #1 issue, sadness, so there's some depression sometimes. It can manifest itself as excessive crying, feeling frustrated, feeling disappointed. Especially for students, I've seen a lot in terms of freshmen and seniors being especially disappointed because, you know, you've been looking forward to leaving the home and, you know, going off to school, and you've been really excited and counting down the days, or, you know, having this newfound independence, and it's being postponed. Seniors, of course, they're looking forward to all the excitement associated with graduation and all the social interactions associated with that. And many times they feel cheated out of those, and they won't have another opportunity. Of course, attention and concentration problems. A lot of students actually avoid online classes because it's hard for them to maintain appropriate levels of attention and concentration, or they already had attention and concentration difficulties and find it especially hard to thrive in an environment in which they are not actually interacting with people. Boredom and loneliness. I think that's true for many of us, because if you live alone anyway. For students who maybe live off campus and are now socially isolating, many of them are not really interacting with anyone, and they went from maybe having a very active social life. And I think about how many people you might see in a day, and that number has decreased down to maybe 0 other than yourself. That is a real challenge. Some students have difficulty even doing their schoolwork if they don't have any set guidelines about how often they have to go into and log on to programs and get information and complete tasks. If they're given more freedom about when they can complete the task, they may get directly behind. And I'm seeing students who've been over 100 assignments behind in terms of high school students and things of that nature who are working from home. The feeling of powerlessness and the loss of control for many of us, and definitely for students, because you don't know what the future is going to hold. How long is this going to be going on? How is this going to turn out? What's going to happen to me? What does this mean for me? Am I even going to be, you know, back on campus again? You know, what does this do for my life? And another one is temporal disintegration, where people can't really feel a sense of time anymore. Maybe like one long day, like or the repeat of the same day over and over again, kind of like Groundhog Day. A lot of people losing the idea, is it Monday? Is it the weekend? It may feel like every day has the same feel to it. There are a lot of other symptoms which I won't go into, but everything from headaches to back pain to grief, especially if you've lost someone to COVID. Anger, violence. There have been some reports of increases in domestic violence. Any pre-existing physical or mental health conditions can also be exacerbated or worsened. And then for some people, they're increasing their use of alcohol. There's also some paranoia. So a lot of people are doing things like hoarding. Of course, we know people are hoarding things like toilet tissue, paper towels, Lysol disinfectant spray and wipes, and alcohol and things of that nature. Sometimes to sell, but typically not. People are just concerned that they're just going to run out. I know that alcohol sales have boomed, and the sale of weapons, so gun sales have skyrocketed as well. So people are concerned about what the future is going to hold and feel worried about safety issues and the need to protect themselves. Sorry. Okay. So population is higher at risk. We've already talked about some of that. It's older people, sometimes children and teens, in terms of being at higher risk for negative effects of COVID or COVID-related stress. Again, I talked about people with pre-existing mental health conditions, people living alone, particularly in community settings without visitors. A lot of like nursing homes have either limited visits or have banned any visits to the facilities in order to try to get a handle on the COVID levels in their facilities, which has increased the sense of isolation amongst the population that was already feeling isolated to begin with, typically. Those with low income and or language barriers, which will also affect diverse students, culturally diverse students. And then there's also stigma associated with having any mental health symptoms, associated with being persons of Asian descent, people who have traveled to either states with high levels of reported COVID cases, emergency responders, healthcare workers, etc. Some general advice. So first of all, you all are people. You're also educators and clinicians and administrators, but you're still people. So it's really important to be able to manage your own stress, to identify your own stress and to manage it effectively, to model that for students. And also to encourage these same things in your students. So finding that middle ground in terms of your anxiety. You don't want anxiety so low that you're sort of not doing anything, you're sort of in denial and not concerned about protecting yourselves, nor do you need to assume that it's going to be the apocalypse, that it's all doom and gloom and there's no hope. You need to have a healthy level of anxiety about COVID-19, enough that you do things that you need to do, like wash your hands and socially distance and wear a mask and all of that, but not so much that you feel that there's nothing that you can do and you may as well just go out and be reckless and sort of live and go out with a boom or, so you want to have that healthy level of anxiety, enough to take the appropriate steps, but not so much that you feel incapacitated or overwhelmed with it. You want to arm yourself with facts. And sometimes that can be a challenge because we have a lot of different messages that we're being told, and the information is slowly rolling out. And so sometimes it may seem as though it's confusing to figure out what the facts are. And it may be a moving target. It's important to be able to get balanced information so that you can make informed decisions about minimizing your risk. We're not going to be able to completely eliminate risk, but finding that level of minimized risk that you feel comfortable with. In terms of the news, you're going to need to take some breaks from some of this. A lot of it is very traumatizing. I know there are certain images that I'm not sure I'll ever forget in terms of, especially earlier on, the images coming out of Italy and New York City. And now with the whole issues related to police brutality, the killing of George Floyd is also traumatizing. So seeing, over day after day, all these various images of, people who have passed away from COVID, or all the issues at the hospitals in which they were overwhelmed, and that can really take a toll on your emotional well-being. It can increase anxiety significantly, and depression, and a sense of hopelessness, a sense of helplessness. All those things are very detrimental to our well-being. And so it's important to be able to take enough breaks that you're not inundated with negativity, but that you still are aware of what's going on, so you get enough information without being overwhelmed with it. We want to also remain socially connected and engaged. So we have to be creative about how we interact with people. I think Zoom has been great. I think there's something called, was it House Party? There's various apps that people are using. So being connected, even the old-fashioned art of writing letters, oh my God, and sending actual greeting cards. People are starting to do that, and that's really nice. Of course, we talked about things that you typically need to do. So the important things are washing your hands, disinfecting things regularly, using facial masks appropriately, social distancing, testing, isolation and quarantine when appropriate, contact tracing, and I put testing in there twice, probably because I'm really focused on testing, both in terms of testing for active infection, as well as antibody testing that will tell you whether you've ever been infected with it. And then do everything that you can in terms of things that are under your control. There's so many things that are not within our realm or within our domain. We do not have control over, but there are lots of things we do have control over. If we maximize our performance on the things that we can't control, then it'll give us a sense of efficacy and power. It will empower us. So what do we want to do? Achieve work and life balance. Even though we're working from home, that does not mean you work around the clock. You still have to clock in, clock out. There are losses and disappointments about what your life would look like or what it is you're going to do. For students, okay, your idea of what your freshman year would look like or your senior year would look like or just your life would look like is different. So it's important to allow yourself to mourn those losses. Also finding alternatives to what you can't do. So you can't do X. Well, what can you do? We think about what we can't do and we focus on that, of course. That takes away our effort and our focus from thinking about, okay, I can't do A, my top choice, or my second choice, or my third choice, like what I'd like to do today. Let me do something else that's on this list. And oftentimes there are things that we can go back and pick up again, whether it's gardening. A lot of people have been doing that. All the things that people say I'll do when I retire, or I'll do when I graduate, or I'll do in the summer, you can go ahead and do now. We can also learn from past pandemics. This is not the first time we've had something like this. We can learn a lot from what happened with HIV and other pandemics, more distant pandemics. So we can look at those and see what have we learned, and to remind us that we as a species have encountered this before. We've done well with it, we've done poorly with it before, but it's ended. It has come to an end. This is not forever. You're not going to be in your house forever. This is not going to go on forever. There will be at the other side of this. The question becomes, what are we going to learn during this time period that will better equip us to be on the other side of this? We need to learn to appreciate the little things. Oh my God, there are so many things that I seriously took for granted. And a lot of my clients talk about that they took for granted. Just being able to go and spend time with someone, to get a hug, to give somebody a high five, to just go to a concert or just go to dinner, just sit and have a good time at dinner, ride in the car with someone, date if you are someone who needs to date, or meaning you're not in a long-term relationship. Yeah, dating is important, and not being able to do that. It's amazing all the little things that you can really miss. And you can think about all the missed opportunities. And a lot of times there's regret about that. But you can also think about, okay, when I get the chance to do X, Y, and Z, well, how am I going to do that? What's that going to look like? And start planning for that to allow you to be more future focused than past focused. A lot of people are talking about what they call corona clarity. So that with the coronavirus, allowing people to get clarity about what's important in life, whether or not their life is what they want it to be, or have they been postponing enjoyment and fun and excitement just to make money, or it gives you a chance to reinvent yourself, whether it is you and if you're a business person, or you as a professional, what kind of work you want to do, are you living where you want to live? Last piece is all just enjoying your life. I think a lot of times we think that school or work is our life, and it turns out it isn't. Your life is your life. You attend school and you work, and it gives your life meaning. It allows you to do certain things, but it isn't your life. There's something you should be doing independent of that. And I think a lot of times we spend so much time on school and work that we don't really think about, well, what do I need to do to have a life outside of school and work that is just as important and just as consuming of my time and energy as school and work. So it's a chance to get a life or enjoy the life that you have. Okay, so what are the things that you can control? Everything from what you eat and how often you exercise and your sleep, and whether you use alcohol, or if you are using drugs, to refrain from that. Humor is free, so no matter how much money you've lost, you can find humor. A lot of comedians do that very effectively. Keeping a routine will help in terms of you keeping track of the days. So, especially for children, it's very important, but for all of us, it's important to have each day have its own flavor. Maybe Mondays you do this, Tuesdays you do that. Every day you get up at a certain time. That can help you keep track of the day so that every day has a special feel to it, as opposed to feeling like every day is the same. You can try different breathing exercises or meditation. This is mediation, doesn't it? Well, mediation can be useful when you're having conflict. So there's a lot of times when families who are stuck at home, the kids and mom and dad or whoever, grandparents or whoever's in the household, it's a lot of time spent together, and you can start to have a lot more conflict. Or maybe you already had a relationship that was, a difficult relationship anyway, and you may need mediation. So you may need to have someone outside or another family member to mediate the situation for you. Tai Chi, yoga, meditation, all great. In terms of controlling stress, in terms of keeping you centered and grounded. Also helps, all those things typically have been shown to help in terms of disease management. So if you are dealing with hypertension, diabetes, liver, kidney issues, those types of activities, everything from breathing exercises, all kind of relaxation training and relaxation exercises can be very helpful in managing diseases as well. Giving yourself things to look forward to. That's awesome. So one of the things that I have really learned is, by planting flowers, I look forward to, how many tomatoes am I going to have tomorrow? Or will my tulips, bloom by tomorrow? Or there's always something. And if you have it, that there are certain things you love to do that you do every day or you do on a certain particular day, it gives you something to look forward to. Not just the long range things like, when I can go back to work or back to school or get back into things. And of course, counseling or therapy is very helpful. With telehealth being available, those providers who weren't doing it before are now, like myself. In addition, a lot of insurance companies are waiving copay. So if you only have a $25, $40, $50 copay, insurance companies like United, for certain, but others as well, are waiving copays. So you can just attend without having a payment. So that's an important thing to consider. So that's one thing that is actually an amazing outcome. Of course, for those people who need access to crisis services, there are available everything from 911 to disaster distress helplines to domestic violence hotlines, etc. And also some states have their own numbers. I know we do here in Georgia. These are all things that you can do to reach out. You don't have to be suicidal. Of course, if someone is suicidal, they can call these numbers. If you just need someone to talk to, you want to find out about resources in your area, you can do that as well. Additional crisis line information. So how do we support and advocate for students? Okay, so there's lots of different ways. Clearly, social isolation, loneliness, lack of social engagement are all important factors, things that need to be addressed. A lot of times for students and for faculty or for instructors or professors, engaging in online teaching or online learning can feel sort of dry and sterile. And so there are ways of making those online classes a lot more engaging so that you can promote social engagement and connection among students and between the instructor or professor and the students. So everything from using an informal teaching style, using humor, icebreakers so people can get to know each other, small group discussions so that people can form relationships and bond more one-on-one or in smaller groups. Use active learning. Some suggestions have included using a buddy check-in system, streamlining class requirements, because there's a lot to keep up with. Everybody's making these changes. The students are stressed and worried and dealing with financial issues and possible loss of insurance, worried about their family members and or having lost someone. Keeping in mind we're in the middle of a pandemic and it's a lot to keep up with, and that it might make sense to streamline things, as well as consider just pass-fail grading, so the students are not overwhelmed with everything else. Where am I going to eat? What am I going to do for money? How do I pay my rent? How do I deal with the fact that I've lost my health insurance, or my mom lost her health insurance, or I have family members who are sick, or I'm worried about family members being sick? That's a lot to keep up with. To expect the students to do all of that and to keep up with so many different requirements and be worried about their, what sort of grade they're going to get, whether, they're going to get an A or B versus pass or fail, that eliminates a lot of stress on students. The other thing is, given the financial constraints of many students, considering partial tuition refunds would be great. And a lot of students have told me that that has been their experience. Excuse me. Other things that could be done. Okay, so in terms of dealing with the issue of cultural competence, we want to be able to develop culturally appropriate programs to address COVID-related losses. So that means loss of access to certain resources. For certain students, all students or many students, independent of race or ethnicity, can experience losses of access to resources as a result of COVID. But it is especially important or especially relevant for culturally diverse students, because oftentimes being on campus can be seen as an upgrade in some situations from their previous housing or income-related status when they were in their families. And so for students who suddenly lose their housing, they may have difficulty going back home. If they lose their jobs, whether they lose actual jobs on campus or just jobs in the community, they lose access to grants or fellowships. Sometimes their parents may have lost their jobs or have had decreased income because they've had fewer hours to work. Sometimes I've had clients, actually frequently I've had students whose parents lost their health insurance. So students were scrambling to try to get their own health insurance. And so there were periods in which they had no health insurance, no coverage whatsoever, and maybe not access to services on campus, or were unaware of what they needed to do. Some students lose their access to technology. Either they don't have internet access from home, or they have internet access, but it's patchy, or they don't have a laptop, or they have an older laptop. They may not have a printer. That's pretty common for people not to have printers at home. And in other situations, they may not have things like, access to clean water, or have just have various utilities other than water. So electricity, or whether they have, hot water in their house may also be an issue. So it's important to keep those things in mind when you're asking students to do certain things. They may have to overcome a lot in order to just get the bare basic level of resources that they need in order to perform. In addition, they may be home helping their parents, helping to educate their little sisters and brothers. They may have to help their parents in some way, or help the grandparents who may be ill. And so they may have increased responsibilities if they're at home, and fewer resources. So it's going to be important that schools, colleges, universities, keep that in mind for students in general, but especially for culturally diverse students, to be able to address their need for resources. And also to provide outreach and funding opportunities for students who are at risk for school dropout. So we already saw that culturally diverse students have reported that they have more of a concern that they won't be able to enroll or won't be able to re-enroll in school because of COVID-19. And so if we want to retain those students in our educational institutions, we're going to have to be able to provide outreach to find out what's going on. I've noticed that you haven't been participating, or, are there any concerns that you have about enrolling? And then also provide funding opportunities to address those students' needs. And last, I would like to provide another way in which you can support or advocate for students. Keep in mind those students who are higher risk for severe emotional reactions to COVID-19. We talked about those people who, number one, may already be predisposed. As we know, students in general have reported high levels of depression and anxiety, especially their first year in college and also around finals and midterms and things of that nature. So that's an important factor to consider, but especially amongst culturally diverse students who may, in which in their communities may have higher levels of stigma associated with even talking about mental health symptoms, admitting to having a mental health condition, and accessing mental health treatment. Stigma is significant in terms of people's willingness to consider getting information about mental health conditions and also accessing care. That concludes my presentation. I hope that what I have shared with you today has been helpful and will be useful to you. I have been very honored to be a part of this, and I'm looking forward to possibly interacting with you all during your activity on Friday. I hope that this week has been highly productive. I hope that you all are invigorated and motivated to go back to your institutions and make some positive changes on behalf of all students, but in particularly those culturally diverse students that you interact with and develop programs for. Thank you very much.